So a big part of your practice, I guess, is removing metal, amalgam from people's mouths.
You know, it's not just removing the amalgam. You know, you're removing some bad material. You know, mercury is not good in nowhere.
Okay.
And we still put it in the patient's mouth. I don't get it. Today, I really don't get it. And many dentists, they still put in amalgams.
You don't?
I don't. I stopped doing that. Anything that has to do with metal, I remove it out of my practice.
Okay.
Why? Because we're going to finish changing that in the future. And that's going to give me many problems today. So you have an idea how good is the metal. 80% of my indirect restorations, meaning crowns and onlays, they're coming because big amalgams and they're failing. So I am repairing dentistry. So I like to do when a patient comes in and they have all these ugly amalgams, I tell, I'm going to suggest to change them because I want to practice preventive dentistry with you.
Okay.
I'd rather you change this filling that is going to cost you, if you have insurance, whatever, the copayment, or if you're going to pay out of pocket, you know, it even gets better because my white filling or tooth color filling and I use the amalgam as an idea, they cost the same price. So you pick which one you want. You want the ugly one or the nice one? You're going to pay the same thing.
Yeah.
You know something? Sometimes I go like this. I should be double charging to put an amalgam. Why? Because I'm going to change it in the future, correct? So might as well charge it today.
So your metal-free lasts longer as well?
It lasts longer.
So when I walk around and I see that gray line at the top of the tooth,
Oh,
those you can, in one visit, give them a new crown, same day. Is that right?
When I see
Because you see that a lot, right?
Oh, yes. And to be honest with you, Randy, I am not so scared to say, Randy, you have an ugly tooth. I'm not. Because ugly. Now,
If they ask you.
no, even if they don't ask me. Because I have to let them know that tooth is ugly.
Okay.
You
Well,
know,
that's if they're in your practice, not on the street, not on the street.
No, if they're in the street and I say that to somebody, I think they're going to hit me in the face. Okay,
So in your practice,
in my
you say
practice,
that's not a good-looking tooth.
It's not a good-looking tooth.
Yeah.
Let's change it.
Okay.
But after I say that, patients reply, Dr. Vasquez, since I got it, I did not like it. But sometimes we're dentists, we're scared to say the truth to the patient. But I have learned how to come across so I will not offend somebody. Because I go like, you know, today we do these metal-free, you know, restorations, and when you see the black line around there, it's metal. It's just the shadow of the metal with the tissue, and it looks bad. Let's change it. Let's make it. Let's
Well, who
make
can
something.
say no to that? Everybody says yes.
Most of the times, it's a yes. But a lot of times they haven't even considered doing that. It's not in their plan.
So they have to think about it.
They might think about it. But
And every time they look in the mirror, they see that metal.
they see me. I'm like a little devil. Ooh, Dr. Vasquez told me that, you know, that he doesn't like that too. And it's like, I just plant the seed. And when they're ready is when they come to my practice and Dr. Vasquez, get this thing out of my mouth. And I go, let's do it, okay? And we're gonna do it today. Because again, with same-day dentistry that I practice, I take that off. Patient, you know, they leave in about an hour and 1 hour and a half with a beautiful front tooth.